Welcome to the Training for Healthcare Professionals. This module focuses on patient rights. Let's look at the key learning objectives. After completing this module, you will be able to explain what patient rights are, identify the 6 rights of the patient, know what to do in case the right is violated. Now let's see, what are the patient's rights?
Click each hotspot to know more.
Freedom of expression, decision-making, right to information, to maintaining personal dignity. Let's get started with the 6 basic rights of the patient, which we should acknowledge and respect at all times.
Click each tab to know more.
Right to information. Patients have a right to receive information about their illness, recovery, expected cost, plan of care, identity of caregivers, and other healthcare choices to help them make decisions. Patients have the right to obtain complete information concerning their diagnosis, treatment, risks, benefits, and any known alternatives. For example, if a patient asks for information on medicine, dosage, and the reason for taking them, please explain the prescription to the patient. Right to confidentiality. Patients have the right to privacy and confidentiality about their personal information. They also have a right to maintain privacy about their medical condition and illness. Patients have a right to maintain confidentiality and security of their medical record. This information may not be shared without the patient's permission. For instance, do not discuss the name or other personal details of the patient against the patient's wishes if you are discussing the patient's case with anyone, such as your colleague. Right to amendment. Patients have a right to amend or update any medical information that may be incorrectly documented for medical records. For example, if a patient asks to revise his or her previous illnesses, allergies, etc., reconfirm the same and do the needful changes in the medical records. Access to medical care. Patients have a right to access quality health care regardless of age, sex, race, national origin, and handicap. For example, do not discriminate between one patient and another just because one patient comes from a poor economic background or is of a different nationality. Right to choice. Patients have the right to accept or refuse medical treatment. Patients have a right to know about the risks and the benefits of any treatment before they decide on the treatment. Patients have the right to appoint someone to make decisions for them concerning their medical treatment in the event that they become unable to make such decisions. For example, if a diabetic patient refuses to take insulin, check his or her blood sugar, explain the risks and benefits of the treatment to the patient, but never force the patient to take insulin. Right to respect and dignity. Patients have the right to respectful care that recognizes their personal dignity and individuality. Patients have a right to their personal values and beliefs. For example, always pull the curtains when the patient is being given a bed bath. Do not allow any other person to walk in at that time.
Hello Karishma, how are you? How is your health?
I am much better now, Sunita. Thanks.
You look worried.
I'm actually upset, Sunita. The nurses at Lifeline Hospital disclosed my personal information without my permission.
That is serious offense. You can talk to the Patient Redressal Committee in hospital or take them to court.
What happens if any of the patient's rights is violated? In the case of violation of the patient's right, the patient can file a complaint with the medical council, or the patient can approach the hospital's patient redressal cell.
Most patients in India treat their doctors like gods and have an unquestioning trust in them. However, in recent times, there have been cases of medical negligence and/or malpractice due to which the patients have suffered physically, mentally, financially, and emotionally. In 1995, the Supreme Court brought the medical profession under the Consumer Protection Act, and medical treatments were labeled services. As per the Consumer Guidance Society of India, the patients have certain rights as a consumer. To begin with, patients have the right to be told about their illness and to have their medical records explained to them. They should be told about the treatments and medicines that are prescribed to them. They need to be made aware of the risks and side effects, if any. They have the right to ask questions and clarify their doubts. Patients also have the right to know a doctor's qualifications, further have to be handled with consideration and with due regard for their modesty when being physically examined by the doctor. Individuals can also maintain confidentiality regarding their illness and can expect the same from doctors. Patients can go for a second opinion if they are doubtful about the medicines or the treatment suggested. They have the right to know what a suggested operation or surgery is for and the possible risks involved. If he or she is unconscious or unable to make the decision due to other reasons, informed consent needs to be taken from the nearest relatives. Medical records or case papers should be available on request from the doctor or hospital if required. If the adverse situation where a patient needs to be moved to another hospital, he or she has the right to know the reason for it. They also have the right to make their own choice after consultation with the doctor. All patients have the right to get details of the bill they have paid for. We've covered the rights, but what's equally important is patients understand their responsibilities as well. After all, the doctor-patient relationship is a two-way street. The patient should undergo the treatment as prescribed by the doctor and should follow his or her instructions diligently. They need to be punctual for the treatments and the follow-ups. If the doctor has prescribed certain preventative measures in case of infections, the patient should follow the same. All the medical records and prescriptions should be maintained. If the patient wants to go for a second opinion, they can consult with their doctor about the same. Lastly, patients should pay for their treatment as applicable to the doctors and hospitals promptly. For more such information related to your health, log on to health.india.com.
Please refer to the following links.